everybody. I'm Abby from Drop Bio Health, and it's my pleasure to welcome you to today's event on preventing skin cancer with Dr. John Trinidad from Osana Care. Before we start, I wanted to tell you a little bit about how we at Drop Bio Health can help you to know your body and own your health. Connect with our community to understand how committed lifestyle adjustments can improve your health in the long term. Learn the latest evidence-based health insights brought to you by our network of wellbeing experts, and then take the wellbeing test to see how your habits impact your health. With only a few drops of blood, the wellbeing test allows you to gain insights and track changes across sleep, stress, energy levels, nutrition and diet, exercise, inflammation, and alcohol consumption. Don't forget to follow us on our social media channels to keep up to date with our events and health resources, and join the waitlist to take the wellbeing test when we launch at the end of this month. We're excited to share that all waitlist members will also receive a complimentary physical and mental health assessment from the Osana team, valued at $199 with the wellbeing test. To join, visit our website at dropbio.com or via the waitlist link in our chat box. So today we're really excited to welcome Dr. John Trinidad from Osana Health Clinics. John has a keen interest in preventative health, emergency medicine, general medicine, men's health, and skin cancer medicine, which of course we'll be chatting about today. Today we'll be learning about the prevalence of skin cancer today in Australia, why and how we get skin checks and who needs them, and we get the lowdown on vitamin D. So welcome, Dr. John. Why have you chosen to focus on skin cancer medicine in your practice as a GP?
Oh, good afternoon, Abby. Firstly, good afternoon to everyone as well. And thanks for having me. Yeah, why skin cancer medicine in general practice? I started general practice in 2015, and I've realized that there were a lot of patients who were not getting checked. No, skin checks were not done regularly, and people were randomly coming in having moles and spots looked at. Back then, I wasn't really familiar with what I knew what the melanoma looked like, but I didn't know what the other skin cancers were or how severe they were. I was working in Port Macquarie then in Wauchope, so by the beach. So we had a lot of patients who were coming in with skin concerns. And that's where I wanted to open up, because it's scarcity of specialists, dermatologists, as well as skin cancer clinics. Regional and remote New South Wales was very low. So I decided maybe make myself available as well. And the interest came as I'm keen on procedures. I like procedures. I like cutting, stitching, with a background of emergency medicine before getting into general practice. So that gives me a bit of a break from your traditional general practice work.
Yeah, excellent. And
Yeah.
Yeah, and as you say, I mean, we'll dig a little bit more into who needs skin checks and how often, but I'm getting a sense that the answer is a lot of skin checks need to be performed in this country every year. So it's wonderful to have more and more GPs like you offering that service as well. Also,
Thanks. Yes, I agree. I think it should be routinely done as a screening tool,
yeah,
rather than just a reactive consultation where if something comes up, that's when you get it checked.
yeah. Excellent. Well, we're really excited to jump into that and find out a little bit more about that exact topic. Before we started, I just wanted to really quickly let everyone know a little bit of housekeeping. If you have any questions for Dr. John that you would like to have answered in today's session, we really encourage you to submit those in the chat box, and I will be reading them out to him after his presentation. The chat box is on the right-hand side of your screen on a computer, or look for that speech bubble icon at the bottom right of a mobile phone or tablet. But for now, I'm going to hand over to you, John.
Right. Thank you.
Thanks so much.
Okay, let me just share. Right. So today I was invited by Drop Bio to talk about skin cancer prevention, and management. If I go too fast, please send us a chat. I can slow down for you. Okay, so skin cancer management and prevention. Firstly, I'd like to begin by acknowledging traditional custodians of the land, their continued connection with land, water, and culture, and we pay our respects to elders past, present, and emerging. So the first question is, why are skin checks important? In general practice, about 20% of presentations would be due to skin issues. By the age of 70, about 2 out of 3 Australians would be diagnosed with a type of skin cancer. Skin cancer is very prevalent in Australia, one of the highest rates in the world. And about 1,800 to 2,000 Australians unfortunately die from skin cancers every year. The importance of it is that melanomas, which are the most sinister types, there are rarer kinds, but this is the more common sinister type of skin cancer. It has a 92% 5-year survival rate if diagnosed early. So what does that mean? It means patients who were diagnosed with a melanoma were followed up after 5 years, and 92% were alive. So this is the importance of getting skin checks. How does it occur? Skin cancer basically develops from constant exposure or heavy exposure to sunlight, specifically UV rays. And these ultraviolet rays are pretty much classed into UVA and UVB. UVA is just this constant sunlight that penetrates the ozone. We're constantly exposed to it, and that usually can cause skin damage. The UVB is the sinister one that can actually cause DNA changes and stimulate the production of abnormal cells in our skin, producing melanomas. So I'll get into that deeper later on. But the best thing to do for now is to be familiar, at least, that UVB rays are the sinister ones. 15% of them penetrate the ozone, and exposure to those can cause significant sun damage and skin cancers that are significant enough to make people unwell. Now, who is at risk? Everybody's at risk. I think we all are. Everybody has skin cells or cells in their skin called melanocytes, and these melanocytes produce melanin, which is the pigmentation of our skin. And unfortunately, some people, their melanocytes don't produce enough or as much melanin. And these are the light-skinned patients or people or population. And the dark-skinned ones have more melanin, therefore are more protected against that UVB ray. In saying that, it still has a risk because we have these melanocytes. Constant exposure or persistent exposure to these UVB rays can still change the structure of these melanocytes, turning or giving us melanoma. So everybody's at risk, and it all boils down to significant sun exposure. So I'm not sure if you can see this clearly. This is the Fitzpatrick skin type that we have. And if you have a look, type 1 are pale white skin, redheads, sometimes blondes, blue-eyed. They always burn. They're at the highest risk. Type 2, I'd say, is just as high as type 1. And they burn easily and they tan poorly. Type 3 is when patients who are of fair skin as well, but they tan better and they tan well over time. And you'll have the light brown skin, the brown skin, and the dark skin, which are of lower risk. I wouldn't say low risk, I'd say lower risk. So yeah, those are the skin types. Whichever you fit in gives you your possibility of sunburns or risk of having skin cancers. So how often should we have a skin check? Self-checking is just as important. I always recommend patients to self-check every 3 to 6 months. Just be familiar with the exposed areas and the areas that you can actually visualize, and leave the rest of the areas to us. Or if you have a partner at home who can do the checking for you, or just have a look at your back and make sure that they look familiar, nothing's grown. So patients who are high risk and have lower risk, I've actually categorized them. Technically, I would strongly recommend patients of type 1 and type 2 to have at least 12 monthly check, regardless of the age, even if that table says for type 1 skin, more than 45 is at higher risk, and type 2 if you're more than 65. So in other words, the older you are, the higher the risk you have, simply because the more exposed to the sun you were. So type 1, type 2, I'd put them all on 12 monthly. And patients with a history of melanoma, patients with a family history of melanoma, I would say was high risk as well. Patients with lots of freckles and more than 50 or 50 to 100 moles around their body, I think they would be classified as high risk. I wouldn't suggest maybe a 6 to 12 month with them. The patients with a history of melanoma, a family history of melanoma, a 6 to 12 months as well. Patients who are on chemotherapy or even on immune suppressing medications for similar to or such as ones used for rheumatoid arthritis are at risk as well of developing these types of skin cancers. So these would be a 12 monthly check as well. Patients with a history of non-melanoma skin cancers, which are a basal cell carcinoma or a BCC, and SCC or a squamous cell carcinoma, once you've had a history of them, they need to be checked at least every 12 months, or whenever issues arise, please see your GP if they're confident enough with skin. If not, they would send you to a specialist. For the lower risk, there's actually a medium risk, but I got rid of it because I don't think there should be a medium and a low risk. I think should be a high risk and people who are of lower risk rather than low risk. So I wouldn't go more than 2 years in patients who will not have a skin check. I would rather you did it every 2 years, simply because we're located in Australia and we're all at high risk because of the strength of the sun. And obviously, if you get sunburn often, do it every 12 months. Now, how are skin checks done? When you come in for a skin check, usually doesn't take much. A quick 20 minutes if you have minimum moles or very little moles and not much concerns. It's just for a screen. It can take up to 20 minutes. And usually if there's a bit more complicated, maybe 30, unless procedures need to be done. Now, what happens is when you come in for a skin check, we talk to you first about the history. We take a history, we classify, or we try to put you on a risk stratification. We try to see how high risk or low risk you are, because if you are high risk, then it tells us maybe we need to be more meticulous into looking or doing that skin check. So those risk factors were as stated on the previous slide. Now, with your specific spots of concern, we would like to know if during the skin check or even before the skin check, if you had specific concerns or specific spots that you might be worried about. Make sure the GP flags this, writes it down, or at least documents it or notes it so that it won't be missed and it won't be forgotten. So you don't have to come back going, oh, I think he didn't see this spot. So it's always good to flag that. These specific spots of concern when you come in for a skin check can be done firstly before doing the whole general check, just to get it out of the way. I think that would be a safer thing to do. Now, the examination should always start from the scalp and should always go down to the feet, the soles of the feet, in between toes. Most of the time, you are supposed to expose all areas. With areas that are covered by your underwear, most of the time we don't need to go there, but if you're conscious enough at home and you see it and there's a spot that you're worried about, always good to have it checked. Or if you're just absolutely concerned and you're high risk, then expose all areas. Exposing all areas would be recommended. One thing with skin checks is you should notice that patients are, or the doctors have a dermatoscope. It looks like this. And basically it's a magnifying glass with high strength LEDs. And a skin check without these isn't a proper skin check. That's got to be done properly, and this eliminates the need to look at it with your own eyes, with your naked eyes, and only making the assessment then. This actually identifies changes in color deep within the mole or the skin lesion, so it always has to be used. Now, what do we look for? So even what do I look for, and this is what patients should look for as well when you look at it, when you look at your spots at home. Basically, we follow a mnemonic is what we call it. It's A, B, C, D, E. Firstly, the A means asymmetry. If it doesn't look oval or round and it has an odd shape, then please flag that and get it checked. Borders have to be looked at as well. So if it doesn't look smooth, it's the contour is not just quite as clean, then get that checked too. With colors, any uneven color, any uneven color, a few dark spots or a blue spot within the mole that just doesn't look even or doesn't look normal, please get that checked. So anyone with a large diameter of about, I'd say about anything above 7 millimeters, sometimes above 5 is actually reason enough to have it checked. And evolution means changes, any changes to a spot or a mole, please get it checked. So one of the newer criteria, that was the old criteria, A, B, C, D, E, the newer criteria, because there are melanomas that are pink in color. So this EFG was given rise to because of that concern. So anything that's elevated, firm, and growing needs to be checked urgently, or needs to be seen by your GP. Now, what else do we check? We look for the ugly duckling. Basically, you'll have a variety of moles, and these moles, most of the time on your own skin, will look similar. And if there's one that you spot that just looks different from the others, this is the ugly duckling. That has to be flagged. You have to come in and get that checked. So what happens after a skin check? What happens next? We do a few things. So there are some spots where some GPs might say, let's observe that spot. Let's keep an eye on it. Come back after 3 months. Or sometimes they'll go, it looks inflammatory. Let's put you on a steroid cream for a couple of weeks and see if it changes, see if it improves. That would be one of the aspects, but observing can be a risk, simply because if the GP is not comfortable about a spot and says, let's look at it again after 3 or 6 months. In my case, if I'm not comfortable with the spot, I'm going to do a biopsy. I wouldn't take the risk of following up after 3 months just to find out the patient had gone interstate, lived somewhere else, forgot about the spot, forgot to get it checked. So I would have that biopsied in those situations. Now, talking about biopsies, they're fairly quick, 15 to 30 minutes, depending on the biopsy. It's a punch biopsy where they get a piece of skin under local anesthetic, or they can shave the lesion off and send that for pathology where no stitches are needed. Some biopsies are large enough that you might need 1 or 2 stitches. It's a quick procedure. Yes, it will have a bit of pain simply because of the anesthetic, but the whole procedure itself should be pain-free once the anesthetic kicks in. Excisions or cutting things out. That's normally done when you're actually confident about the diagnosis, or you're thinking, oh, this just doesn't look right. That has to be taken out. And a proper excision rather than just a punch biopsy or a shave biopsy should be done. Next one would be medicated creams. I'm sure you've heard of these creams such as Epidix or Aldara. Epidix is a chemotherapy agent. It's a cream used for sunspots and some types of SCCs. And Aldara is another one used for sunspots as well as basal cell carcinomas. These medicated creams should and could be used if the GP is confident about, or the skin specialist is confident about the lesion. Most of the time, these things are very, very effective. May have undesirable side effects, such as burning and redness and stinging sensation, but it actually very is effective. It has a 92% clearance rate of the sunspots, which are precursors to skin cancers. Cryotherapy, I'm sure you've had those too, or you've heard of them. Zapping, I had something zapped, I've had something frozen off. That's cryotherapy, and cryotherapy is done with liquid nitrogen. Few bursts of it usually is enough. And the thing with these cryotherapy, I would strongly recommend that the GP is actually confident about what he's zapping, and he knows what he's zapping, because zapping a sinister lesion, and you'll never know what it was once it's been zapped, because it disappears. So if it was a melanoma that they've just zapped, they wouldn't know if it actually was a melanoma. Give you a history of melanoma, you wouldn't know. So I would strongly recommend that if this gets done, that the GP is actually, or confirm that the GP is actually confident with this diagnosis before zapping it. Referral to specialist. So yeah, referral to specialist is very common as well. If the GP is not confident enough with the diagnosis, and they're not confident enough to do a biopsy because it falls in a tricky area, such as close to the eyes, tip of the nose, on the lips, on the ears, sometimes on the fingers are very tricky as well. In these situations, referral to a specialist would be good. Or patients who are high risk, patients who've had history of melanomas, patients who have lots of freckles can be referred to a dermatologist, because they have something called mole mapping. And patients who have these have photos of their whole body with their moles, and these things are clearly recorded. And every year they can compare the existence or the presence of these moles. And if there are new spots that appear, they appear on that mole mapping and it's flagged. So referral to a specialist is good too. Now, how do I avoid skin cancers? I'm sure you've heard of the slip, slop, slap, seek, slide. That's basic. Everybody should be doing it. Sunscreen is a common issue as well, and common concern, because they want to know if they have the right type of sunscreen. Am I using it correctly? Why do I still burn even while I use it? So you'll have SPF 30s and SPF 50s. SPF 30s are recommended by the Cancer Council of Australia, and SunSmart as well. SunSmart app is available, but that's by the Cancer Council in Australia, and that actually tells you how much UV is present during the day. UVs can range for anywhere from 1 to over 11, and if it's above 3, then you're at risk of burning. So using this SunSmart app tracks your location. If you give them your location, it'll tell you how much UV exposure and what time of day. So this is where sunscreens will be needed. Once it says, it'll tell you actually when it's required. So that's a very, very good app. I've been using that as well, using that on my kids too. And one way to avoid skin cancers or prevent them complications is getting regular skin checks. Now, what about vitamin D? That's a big issue here. A lot of people talk about that. What happens to my vitamin D when I try to avoid the sun to avoid skin cancers? So vitamin D, let's talk about that first. It's a vitamin significantly sourced from the sun. It has other sources too. Food is a good source of, well, not really a good source, not as much as the sun, but it can provide you with some vitamin D, such as egg yolks, mackerel, oily fish, wild salmon. They do have vitamin D as well. So the role of vitamin D is it helps with muscle bone strength, immunity, and mental well-being. Even it said it brightens up people today when they have adequate vitamin D, or sometimes they just feel flat when they don't have adequate vitamin D. That's been studied. Now, what factors? There are a lot of factors that influence the absorption or a person's vitamin D levels. So one would be where you live. Thing with where you live is that it has actually shown that sunny areas or places that have hot summers or sunny or long summers would provide you with adequate vitamin D or good vitamin D, making your exposure to it less to provide you with an adequate amount. Air quality is one of them as well. Highly polluted areas can scatter vitamin D, therefore reducing the exposure to vitamin D by on people. The thing with that, yes, you don't get enough vitamin D. Your quality of air is not good as well, and that destroys the ozone, therefore increasing your risk of skin cancer because the UV rays can penetrate faster or quicker. Use of sunscreen. So use of sunscreen, I'll talk about that on the next slide because I'll go through it a bit more. Skin color, that to patients who have who are lighter colored, so skin types type 1, 2, 3, absorb vitamin D easier or quicker than patients who would be from the 4, 5, 6 brown or dark skin. So they would need those with darker skin would need more or longer exposure to the sun to get the vitamin D that they need. With weight, that's one of them. Weight would be, they say that patients who are obese or patients who are overweight have significant amount of fat tends to store a lot of vitamin D in the fat because D is fat soluble. So sometimes it sits there. The problem with that is you might have enough vitamin D in your fat layer, but it's not being used up and pushed into your bones to give it the strength that it needs. The value of the vitamin D, which increases your calcium absorption, is not utilized when it's just stored in fat. So that becomes a tricky thing too. And with age, the younger you are, the easier you absorb the vitamin D because there's this enzyme that transforms vitamin D into that driver that pushes it into calcium and into the bones. And as we get older, that enzyme depletes. So the older patients are actually more prone to vitamin D deficiency. So will sunscreen cross-load vitamin D? So no, but it can filter up to about 90%, 98%. So no matter how much sunscreen you use, some of the UV rays will still get through. So SPF 15s can block out about 93% of the UVB rays. 30 can block out 97, and 50 can block out about 98. So if you look at it, you'll have about 2 to 7% still of UVB rays getting in. So with some exposure, you cannot entirely block it out just with sunscreen. So how much sun can I safely get? Do I need to get vitamin D that I need? These are based on studies. They say 10 to 15 minutes during spring, summer, and autumn, simply because you have longer days and hotter days. Exposure of your arms, legs, and abdomen, as well as your back during these seasons, exposing them 3 times a week is actually adequate enough. It's enough to give you the vitamin D that you need. So the tricky thing is winter. In winter, they say about half an hour, anywhere from 20 to 30 minutes of sun exposure is adequate. But again, it all boils down to your risks. If you're high risk, then I think I wouldn't encourage it. Use the Sun Smart app because it'll tell you when dangerous rays are out. So technically, the bottom line is food, supplements, and incidental. Take note, incidental and protected sun exposure will give you all the vitamin D you need without subjecting yourself to risks of unprotected sun exposure and complications of skin cancers. Thank you.
Thank you so much, Dr. John. That was really, really helpful and incredibly informative. So thank you so much for taking us through that.
Thank you.
I can see some questions are starting to come through. So please feel free to drop your questions in the chat. That's what we've got this portion of the event for. I'm going to start reading some directly out from the chat to you, if that's good with you, John. Let's get into it. Okay, so Olivia asked, is it significantly less likely for people with darker skin to then get skin cancer, meaning frequent skin checks won't have to occur as often or much at all?
Yeah, look, as I've mentioned, yes, if you have brown skin, dark skin, you are, like I said, lower risk. I don't like to use the word low risk because it makes patients more complacent, and sometimes it eliminates the need. It gives them reason not to have the skin check done because the doctor said so, because
Sure.
I'm low risk anyway. So yes, I would actually recommend. It all boils down to how much sun has that patient been exposed to. So throughout their lives, we're constantly exposed to the sun, persistently exposed to the sun. If you work outdoors constantly, despite being, let's say, Mediterranean skin, or let's say if you were darker skin, African, if you were exposed to the sun constantly throughout your life, I would still recommend a minimum of 2 yearly. Some GPs could actually say, or some skin specialists can actually say, look, you can just do a self-check and worry about something when something comes up. But I try to avoid that, especially in this country.
Yeah, I think in this country in particular, with that huge ozone layer hole right above us in Australia, we do have particularly harsh sun, don't we? Thanks, Olivia, and thanks, John. Linda asked a great question around kids' sun exposure. So she said her son wears a rash vest and has no exposure to his abdomen. Should she be taking his rashie off for 10 or 15 minutes at the beach?
Yes, it's actually a great question. So
yeah,
I didn't cover that. So kids should protect themselves from the sun. Anyone less than, according to Royal Children's Hospital, any child less than 6 months should not have sunscreen. And that's not because of vitamin D. I reckon that's because of potential effects on the skin, or of the chemicals, rather than blocking off the sun, depriving them of vitamin D. So what's recommended there is hats and sleeves up to about 6 months, and then they can have the sunscreen afterwards. After 6 months, there are some who just use zinc creams from 6 months to 6 to 12 months, just as a protective measure. But I still recommend sleeves and hats. Yes, rashies. How old is your son?
Linda, if you can drop a comment, let us know how old your son is. 3.5.
3.5. So
yeah,
3.5. Yes, rashies. Yes, sunscreen. And one thing is, yes, please use the SunSmart app. You can take the rashies off during those times of day that the UV ray is less than 3. It's an excellent app. It's clear, it's straightforward, good to follow as well. So yeah, taking the rashie off while you're at the beach, yes, please, but make sure it's during those times that it's safe.
Yeah, Linda says, thanks, John. And we love a good app recommendation. I know I love a good app. So we'll share that SunSmart app, a link to download that in our Facebook group, which we'll also link you to at the end of today's session as well. So that's easy to find. And just on other assets as well, There will be a replay of this event sent out to you if you'd like to kind of go through everything again. I know there's lots of note taking that I've done, just capturing all this information from John. And we'll also share that chart that kind of grades people around how often they should be getting checks based on their different factors. More questions, so we'll just keep rolling here.
Yep.
Onki asked, does the hair on her head and body protect against the sun?
Yes, great question as well. Yes, it does.
Thanks, Onki.
It does, but it doesn't exclude the fact that you might have creases and lines which is constantly exposed. And if you think about it, your scalp is the first thing that's exposed to the sun. And people disregard that usually because my head's there or my hair's there. And that's where hats come in. Hence the slip, slop, seek, slide. It's all in there. Same thing with ice. Sunnies would protect it too. So yes, the scalp is vulnerable, but if you have a good thick head of hair and you're absolutely 100% that none of it is exposed to the sun, then maybe it's protective, but I would get the scalp checked every time as well as part of the skin check.
That's a really good point. I know with my daughter, she's got a part right down the middle of her head, and a few times this summer she's gotten burnt. And I felt terrible, that mother's guilt, thinking, well, I didn't think about, covering up that part of her body.
You don't normally apply sunscreen on those areas, so you can if you.
I guess you could.
Try, yeah. Hats would be more effective.
Hat does seem, hat does seem to be the way to go. Okay, jumping to a question from Chrissy, who asks, what about vitamin B3 orally to help prevent skin cancer?
That's an excellent question as well. Yes, B3 is actually helpful.
Wow.
There has been a study that 500 milligrams of B3 twice a day is actually preventive. It's B3 is nicotinamide, and they have been proven to prevent further skin cancers. I normally recommend the B3 not to everybody, but people who are at risk of non-melanoma cancers like BCCs and SCCs. Once they've had a few, I mostly recommend, or I give that suggestion of taking a B3 tablet, 500 milligrams twice a day.
That's awesome, Chrissy. You're on the ball there. That's something I don't know about the others. I wasn't aware about that being helpful as a preventative. So thanks for questioning that one. Onki has asked, does certain body parts absorb vitamin D better than other body parts?
Oh, I wouldn't know. I can't answer that question. I'll probably put it down to the areas that the bigger surface areas would absorb more vitamin D, which is why the legs, the arms, or the back, or torso, abdomen, would be the areas that would absorb the most, rather than everything's covered and you just expose your face for vitamin D, then you wouldn't be getting enough.
Yeah, okay. Interesting question, that one. Okay, I might jump quickly to a few of the questions that our community members sent through earlier this week for you, John, because there's a few good ones in there. I wanted to talk about doing our own skin checks at home. Would you recommend using a mobile phone camera to monitor and track skin changes?
Yes, and any camera actually that's clear enough would be good. Tracking as well, taking a photo of your back if you have a lot of moles will tell you what moles were present then, and when you compare it 3 months after, which ones are new, and if there's anything worrisome about that. Checking them at home, I strongly recommend. Again, looking for that ugly duckling, one that you're not comfortable with, get it checked. 3 monthly as well. I would strongly recommend it. But yeah, I think getting it checked using a camera is a safe option, is a good option to use, yes. Okay,
great. In terms of finding a GP who does skin checks, do they mostly have that proper equipment? Or how do we find a GP with that equipment to do a proper skin check?
When I started general practice, one of my first consults was before I even knew how to do a skin check was, can you have a look at this spot? And I looked at it with my naked eye, touched it a bit. It's really hard. You really cannot tell without using that instrument. And it's been very helpful because using that instrument eliminates the need for the GP or the doctor to cut things out unnecessarily. Because when you look at it up close, it suddenly doesn't have those features after all. Some might look sinister from naked eye, but once you get close to it, it actually looks good. So a skin check should have a dermatoscope no matter what. Otherwise, it's not done properly. And I wouldn't rely on that skin check.
Okay. Wanted to ask you about moles. What exactly is a mole, and why do we need to keep an eye on them in particular, as opposed to freckles?
Yeah, look, moles are basically collection of pigmentation, right? And they sit in a certain layer of your skin. You'll have moles that seem to be darker, and those ones are deeper, on the deeper layers of the skin of that mole, and the freckles are on the lighter areas as well. So genetics will play a big factor there as well, a number of moles and how much moles you have. So watching a mole can develop anywhere from childhood to till in your 30s. Any mole, any new dark mole after you're 40, I'd have that checked. So you can develop moles up to your 30s, and any new mole, any change in a mole, what are we looking for when moles change? Thing with them is that the DNA makeup of the mole can change. The mole itself won't, but the DNA makeup of it from within it can change because of persistent sun exposure, and those would be concerning. So those need.
Okay. And in terms of, in regards to moles, can, bumping them or scratching them increase the risk of them becoming problematic?
Injury to moles, no. You have some skin or sunspots where patients have on the forehead or on the forearms, which are sun-damaged skin. Those are called solar keratosis. Those are precursors to an SCC, or a type of skin cancer. I have seen cases where an SCC just got bumped, or an actinic keratosis or a sunspot just got bumped, creating that non-healing wound. Or sometimes some of them is actually grown into a volcano-looking lesion, and those were SCCs. So yes, trauma can agitate or irritate the cells underneath it, but there has to be an underlying pathology already before that happens.
Okay, good to know. John, wanted to ask you about sunscreen.
Yeah.
There's a plethora of sunscreens available on the market. Do you have any tips for choosing a good sunscreen?
Lots of brands out there, isn't it?
Sure are.
One's
Yeah.
recommended by Cancer Council, yes. Make sure that when you get sunscreen, make sure, number one, they are not expired. Number two, yes, there are different types. There are gels, there are sprays, there are the lotion. Whatever suits your fancy, I guess. Whatever suits you, whatever you think is less sticky, just so you can comply with it. Because some people are not comfortable because it's sticky, so I don't use it. The sprays are less sticky. Having a sunscreen that has the word broad spectrum, where it covers UVA and UVB rays, that would be a good one.
Okay.
Sure, it's a broad spectrum. It covers both aspects of the ultraviolet.
Would most sunscreens be broad spectrum these days? Why wouldn't they be if they're not?
A lot of them here are.
Yeah.
A lot of them are just UVAs. There are, I think, some of those ones that are incorporated for makeup.
Yep.
The facial creams and all that. Some will say that they have some degree of SPF. Some of them are UVAs alone.
And the amount that you're applying is really important, isn't it? Because I've read that quite often we're just not putting enough on.
Yeah, that's right. Well, put as much as you can. Basically, what I think they recommended, based on what I read, I think it's like 2 teaspoons per area of your body.
Yeah.
Sometimes I think that area could be big enough that 2 teaspoons is not enough. So make sure you cover that area and rub it in well. In saying that, reapplication after 2 hours is actually necessary, or after getting into the water and coming out, you'll have to reapply again.
Yeah.
So one of those sunscreens would be the water resistant ones. Has to say that as well.
Yep. Definitely been caught out before without the reapplication and gotten quite burnt in the middle of summer.
Yeah.
Super important to remember.
That's right. So you can't just do it once.
John, I wanted to ask a little bit about family history and how much that plays into skin cancer.
It actually plays a big role. That's one of the histories or the information we get during a skin check or prior to a skin check. Genes, patients with history of family history of melanomas or non-melanoma skin cancers are at risk of developing them. So patients who are at risk of melanoma, so family history of melanoma, should have family members who have had a history of melanoma, need to get checked at least every 12 months. That's highly recommended. And patients who have the non-melanoma skin cancers, they just have to be really cautious, because if there's that history, then minor or little sun exposure could actually predispose them to that and put them at risk as well for those types of skin cancers.
Okay. Wanted to ask a question around tanning.
Yeah.
Is there a safe level of tanning?
That's such a quick question. I
Tricky
don't think there is. Exposing, look, baking all day is a no-no. Patients who do that obviously are not after protecting themselves from the sun, so they probably don't use sunscreen either. Lots of sun damaged skin. It ruins the collagen as well and gives you wrinkles. So who wants that? Solariums, quite common. Illegal in New South Wales though. But I actually I've had patients who have their own solariums at home.
Really? Even today?
Mm.
Right.
And yeah, I highly discourage it. So sunbathing, safe way of tanning, exposing yourself to the sun when when the UV rays are less than 3, and getting that, you can build your burn or build that tan or whatever you want to call it during those times of the day. It's safe to be without sunscreen. Again, from that app.
And just touching on solariums, they're particularly damaging, aren't they, in comparison to the sun?
Yeah. Well, it's pretty much like direct UVB rays directly onto your skin. So
right,
just as you don't have to do it frequently or long. Minimal exposure can actually put you at risk straight up.
Okay, good to know. Olivia asked if you can still get a tan using those good sun creams. She knows younger girls who'll hold off from the sunscreen just to get that tan.
Again, the recommended is.
I think we know the answer to this one.
Again, recommended is SPF of 30, and yeah, you can actually get, like I said, even if you're on an SPF 30, you still have it protects 96%. You still have that 4% that penetrates through, especially during those hours. But if you want sun exposure, like I said, less than 3 UVB on the app would be the safest way to do it.
Okay, so if someone wants to increase or get into the habit of going and getting regular skin checks, what's their best starting point? Should they just book in regularly with a GP that does skin checks? Is there any benefit to going to a skin specialist or a dermatologist? What are the options? What's the best course of action?
Yeah, good question. So going to skin cancer clinics are mostly GPs who have solely specialized or gone into just skin or skin cancer issues. That's different from a skin specialist who are the dermatologists. dermatologists do the same thing. They manage everything skin, and some of them specialize in skin cancers themselves. So seeing a GP for skin checks, especially one who's competent enough to actually do it, is safe enough. That GP should know their limitations, though, as to how far they can go with a skin lesion, and how confident are they to do that biopsy if it falls into that spot. But like I said, patients who have a history of melanoma should be under a skin specialist already from the time that they were diagnosed anyway. And they normally do their 6 monthly checks. We can do the 3 monthly ones in between. And seeing a skin specialist again, with if you were a patient with lots of freckles or lots of moles, 50 to 100 moles, or just lots of freckles on your chest and your back or your arms, I think as going to a skin specialist or a skin cancer center with mole mapping, which is where they take photographs of your moles or your body, and then store it into your file, so that if there are any changes or additional moles coming up, it would be flagged.
And I guess that also might depend on where people are located as well. I imagine if you're in a capital city, you've got quite a few different options, whereas regional areas, it might be slightly different as well.
So regional New South Wales, regional or rural areas, I think very scarce. Like I said earlier, it took about for me in the beginning. It takes 6 months, 12 months to see a dermatologist to get skin cancer out. So because I worked there for a while, I had to learn actually to get these things out even before getting them to see the dermatologist. Otherwise, it could just progress.
Yeah, and you can't wait, can you?
Yeah, so we're fortunate here in Sydney that you can actually get in to see if you were able to take a photo, you're confident of your diagnosis, and you want them to see the skin specialist straight away. We can either make a phone call or send a referral with the photos, so that it gives the urgency, that urgency to the specialist.
Okay, that's great to know. I want to just really quickly jump back because I've just seen a question from Linda when we were talking about tanning. I just think it's really important that we go back to it. So she was saying, so is a tan achieved with a 30 SPF safe? Or is it that it's very unlikely that you would be able to achieve a tan with a 30 SPF?
But see, like I said, at 30, you'll have that 4% coming in, right? The fact that you're exposing yourself to the sun with an SPF of 30, it's impossible to cover all areas of your skin with sunscreen. You will have areas, you will have spots that are uncovered, and those are still at risk of developing a sunburn or a skin type or sun cancer or skin cancer that might be an SCC or a BCC. It doesn't have to be a melanoma. So those sun-exposed areas that are not entirely covered can still put you at risk, and which is why we do skin checks, because we have to cover those. We have to look at those areas that are not entirely covered by the sun, or you thought was not covered by the sun.
I do. It does come to mind a recent, I'm not sure how recent now, ad campaign that there is no such safe thing as a tan, and that might be the shortest.
It's a tricky question.
Answer.
Can I sunburn? Yeah, but yeah, look, there's no such thing. I've never seen someone who's actually really applied. You probably forget some parts of your ear, and you know what I mean.
Of course.
There
Yeah.
will be some areas, your toes, the skin can appear there. Yeah.
Yeah, absolutely.
Nice.
Look, I think Olivia, Linda say thank you. Olivia says, thanks, John. No tanning from me from now on. I think that is the safest option there, Olivia. But I think we're pretty much there for questions. That's been super interesting discussion and so much important information today in that talk from you, John. So I want to thank you so much for your time and coming along to the drop-in.
Thanks as well. Thanks for giving me this opportunity, and thanks to Drop Bio.
Yeah, it's been wonderful to have you. Now, if you would like to learn more about Osana, where John works from, Osana's preventative health model, get in touch with the team at Osana through their website, which we've linked below. And as I mentioned, we do have that Osana health check offer at the moment for anyone that joins and purchases the wellbeing test through our wait list. I'd like to thank everyone for your time and your questions today. Really interesting, really engaging discussion. So if we didn't get to your question, please know we will endeavour to have them all answered in the coming weeks.